Good evening, dear students. I welcome you all to another YouTube session. The topic for today is syndromes of head and neck, an overview. Here in this, first let us see the definition of the syndrome. Syndrome is a recognizable complex of symptoms and physical findings which indicate a specific condition for which a direct cause is not necessarily understood. So it is basically a complex of symptoms. Syndrome is not just one particular sign or symptom. It is a complex of symptoms and some physical findings which indicate a specific condition for which a direct cause is not necessarily understood. But a direct cause of that is not understood. That is a syndrome. Basically, in this, we are going to see syndromes associated with certain abnormalities. Lip abnormalities, particularly. What are the syndromes? In this session, I'm just going to give you an overview, syndrome and the main feature. In the next part, we are going to cover the important findings. So in this session, we are going to just see what is a syndrome and what is a finding. It's very simple. Usher syndrome, all of us know double lip. Particularly upper lip, there will be one more extra mass that is called as double lip. Cowden syndrome. Cowden syndrome is associated with pebbly lesions of the lip. On the lip, you will see small pebbles like. That is called as pebbly lesions. So Cowden syndrome. Whenever you hear of the word pebbly lesions, which syndrome that should come to your mind is Cowden syndrome. Everted lip. Lip will be everted. How we see everted margins, rolled and everted margins, raised and everted margins. Squamous cell carcinoma, you will see everted margin, right? So similarly, everted lip, where do you see? Down syndrome. Thick lips are seen in Hurler syndrome. Hurler syndrome is one important mucopolysaccharidosis where we see thick lips. Pigmented lips, where do you see? One important syndrome called as Laugier-Hunziker syndrome. There is a syndrome called as Laugier-Hunziker syndrome. In this syndrome, the patients will have pigmented lips. Where do you see neuromas of lips? There is one important syndrome called as MEN syndrome, multiple endocrine neoplasia syndrome. In this syndrome, the patients will have multiple neuromas. Because of this, the patient will have an appearance called as bumpy lips. Lips will be enlarged. Next, where do you see cleft lip? Very important syndrome called as Gorlin syndrome. See, I have used the word Gorlin, not Gorlin-Gotts. Gorlin-Gotts is different, Gorlin is different. This is Gorlin syndrome. Gorlin-Gotts is associated with multiple OKCs. Gorlin-Gotts. This is Gorlin, which is associated with cleft lip. Protruding lips are associated with one syndrome called as Rieger's syndrome. This is a very important table. You definitely can expect one MCQ from these tables, which I'm going to show you now. A very important table. Rieger syndrome is associated with protruding lips. Lip pits are associated with which syndrome? Van der Waals syndrome. Van der Waals syndrome. So lip pits are basically associated with Van der Waals syndrome. Okay, last two are not important. So here I want you to remember these. So this table is very important where we are going to see the syndrome and the main feature. So very frequently question comes on neuromas of lip, that is multiple endocrine neoplasm syndrome. Double lip MCQ comes on that. Lip pits MCQ comes on that. You can expect a question on even pigmented lips, Laugier-Hunziker syndrome. Okay, so that is the syndromes associated with the lip abnormalities. Now, what are the syndromes associated with the buccal mucosa abnormality? Now, buccal mucosa bilateral lichen planus is associated with two syndromes. One is Graham-Little syndrome. Remember, there is one syndrome called as Graham-Little syndrome, where the patient can have bilateral lichen planus and Greenspan syndrome. All of us know Greenspan syndrome is lichen planus plus diabetes plus hypertension. So we can see Greenspan syndrome associated with the lichen planus on the buccal mucosa. Bilateral oral white lesion is associated with which syndrome? What do you mean by that? These patients will have both the sides buccal mucosa some white patches. They're not lichen planus, they're some white patches. That is associated with one syndrome called as Jadson-Lewandowski syndrome. Okay. Neuromas of buccal mucosa. As we have seen neuromas of lips, you also have neuromas of buccal mucosa. Neuromas of buccal mucosa is also seen with Men syndrome. Oral leukoplakia is associated with one syndrome called as Zinsser-Enagman-Cole syndrome. You have to remember these names. There is no option for this. You have to revise this table. What are the syndromes associated with lip abnormalities? What are the syndromes associated with buccal mucosa abnormalities? Here, there was an MCQ based on Graham-Little syndrome. So they had asked, Graham-Little syndrome is associated with which skin disorder or which oral mucocutaneous lesion? Then it is lichen planus. What are the syndromes associated with the tongue? Macroglossia is associated with two syndromes. All of us know Down syndrome is one syndrome and Beckwith syndrome. Beckwith is Beckwith-Biedermann syndrome. So we should know that Beckwith is very important. That syndrome is very important syndrome where the patient will have a very large tongue. Microglossia, small tongue. Hanhart syndrome. This was one of the question in PGI paper. Hanhart syndrome. Microglossia. Aglossia not important, leave it. Fissured tongue is very important, where you see in Melkerson-Rosenthal syndrome. A very important syndrome, Melkerson-Rosenthal syndrome, where you see Bell's palsy, cheilitis granulomatosa, and fissured tongue. We are going to see details of these syndromes in the second part. In the second part, we are going to see syndromes of all these details. Glossitis, where do you see? Glossitis is a feature of Chidiac-Higashi syndrome. Important syndrome where you see periodontitis, Chidiac-Higashi syndrome. So that syndrome can have glossitis-like features. There are many other syndromes, but important one is Chidiac-Higashi. Hypotonia of the tongue. Hypotonia means the tongue will be very flaccid. It will not have any tone. So that is, tone means strength. That is seen in floppy infant syndrome. Where do you see multiple hemangiomas of the tongue? Very important syndrome called as Maffucci syndrome. Please remember this. Maffucci syndrome is associated with multiple hemangiomas of the tongue. Atrophy of the tongue. Tongue is very small. All of us know there is one important syndrome called as Parry-Romberg. What is Parry-Romberg? One part of the entire face is atrophic. Hemifacial atrophy. Where Atrophy involves skin, atrophy involves bones, teeth, tongue. Even tongue is also small, that part. That is called as Parry-Romberg syndrome. Glossoptosis. What is glossoptosis? Falling back of tongue. That you see in case of Pierre-Robin syndrome. Pierre-Robin syndrome. That is falling back of the tongue, which you see in case of glossoptosis. That is called as glossoptosis. Now, what are the syndromes associated with the cleft palate? High arched palate is associated with one syndrome called as all the important bone syndrome. Appert, Krausen, Marfan, Downs, Treacher-Collin. All these are the important syndromes which are associated with high arched palate. Cleft palate is associated with basically two syndromes. There are many actually. Most two important are Pierre-Robin and God's-Gorlin. God's-Gorlin is associated with cleft lip also, cleft palate also. Similarly, pebbly lesions of palate, where do you see? Cowden syndrome. I've told you, wherever you come across pebbly lesions, let it be lip, let it be palate, it is Cowden syndrome. It is Cowden syndrome. What are the syndromes associated with the gingiva? As already I have told, Chidiac-Higashi syndrome. Mainly it is a syndrome associated with the periodontitis and severe gingivitis. Again, pebbly lesions, as discussed, Cowden syndrome. Gingival enlargement. One of the important syndrome is Cross syndrome. Gingival fibromatosis, Raman syndrome. Okay. Inflammatory gingival enlargement, Papillon-Lefevre syndrome. All of us know Papillon-Lefevre syndrome will have typical features of aggressive periodontitis. Typical features of aggressive periodontitis. Okay. The other syndromes are not important. What are the syndromes associated with the jawbones? Mainly the important syndrome here is micrognathia. Small bone. Where do you see? All of us know Robin syndrome, Pierre-Robin syndrome, where basically the mandible will be small. Fibrous dysplasia is associated with syndrome called as Jaffe syndrome, Albright syndrome. Where do you see cortical thickening or hyperostosis? Basically, the cortex is thick, called as Caffey-Silverman syndrome. All of us know this is very common. Where do you see mandibulofacial dysostosis? Treacher-Collin syndrome. Where do you see elongated styloid process? Eagles syndrome. Okay, others are not important. Leave it. What is a syndrome associated with salivary glands? Most important syndrome, Jogren syndrome, which is associated with xerostomia. Lastly, what are the syndromes associated with the teeth? What are the syndromes associated with the teeth? Now let me enlarge this a little. Microdontia is associated with Down syndrome. Remember, small teeth, where do you see? You basically see this in Down syndrome, Gardner syndrome. Two important syndrome. Macrodontia is associated with a syndrome called as KBG syndrome. KBG. Hypodontia, less number of teeth, is associated with Down syndrome. Altered eruption of teeth is associated with Turner syndrome. Absence of third molars and premolars is associated with one of the important syndrome called as Buccal syndrome. Very important syndrome, please remember, Buccal syndrome, which is a syndrome associated with additional cusps. Ellis-Van Creveld syndrome. Ellis-Van Creveld syndrome, which is a syndrome associated with taurodontism. Mainly two syndromes, Klinefelter syndrome and trichodental syndrome. Klinefelter and trichodental are the two syndromes associated with taurodontism. Talon's cusp is associated with which syndrome? Rubinstein-Tivy syndrome. What is a syndrome associated with enamel hypoplasia? Ehlers-Danlos syndrome. Very, very important. Which is a skin disorder where you can see an enamel hypoplasia. Ehlers-Danlos syndrome. Okay, so this table is very important. This entire table, syndromes associated with the, you can revise this, write down this slowly in a notebook. Go to the video, pause and write down each and every table. What is the feature? What is the syndrome? First is the lips. Then we saw about the buccal mucosa. Then we saw about the tongue. Then we saw about the palate, gingiva, jaw bones, salivary glands, and finally teeth. So this is just an overview. In this session, I have just given you an overview. In the next session, I am going to cover the important findings of each syndrome. So I'll take some few syndromes here, important syndrome, where we are going to discuss the important findings of those syndromes. Okay, I hope this part is clear. In the next session, we are going to see about the findings, important findings, some important etiological part also. I try to cover some etiological part. So this is just an overview, and a single liner MCQ can be expected from these tables. Please write down this and revise. Some of the table, this one are unique. They are very frequently asked, like Ehlers-Danlos associated with enamel hypoplasia. Buccal syndrome. What is Buccal syndrome? Where there is absence of third molars and premolars. Buccal syndrome. So these are some of the unique questions which we can expect. Okay. So the next session, I'll cover the other details and the including the etiological part as well as the important features of some of the syndromes.